So welcome back, everybody, to the Future of Podcast. We have a special guest with us here again, Dr. Kashif Pirzada. He spoke to us in January about all things coronavirus, as he's an emergency doctor in the Brampton area. And we thought, given everything, given the forecast and what's going on in Ontario and in Canada, when it comes to the pandemic, this would be a great opportunity to have him come back and we could have a discussion around the third wave, things that have been happening, and again, maybe revisit the optimistic sort of timelines of the pandemic in January and see if they still hold up. So welcome today.
Thank you, Vasi, and thank you, Azam, for having me.
Nope, pleasure's ours. So let's start off. So in January when we met, we were sort of towards the end of the second wave, and we felt there was some cause for optimism. Vaccines were starting to roll out, and we felt that way we could probably get ahead of the curve a little bit. But right now we're dead in the middle of this third wave, and things are as bad as they have ever been, if not worse, right? I think Ontario today announced like 3,600 cases or something of that sort. So the 7-day rolling average is really in the 4,000 range or so at this point. So given where we're at, how do you see the scenario play out in the next couple of weeks or a month, Kashif?
So the next couple of weeks are going to see the biggest strain on the health system in Ontario that it's ever seen. We're adding, 70 patients to the ICU every day. I'd say the capacity is probably about 900 in normal times to take COVID patients because there's already people there who are there for other reasons like big strokes or heart attacks or infections. And then when you reach that, we'll see what happens. Right now, the hospital I work at and others are basically expanding the ICUs by taking up every available other space in the hospital. So the recovery room for surgery, that's gone. That's an ICU now. The recovery room for heart attacks, that's gone. That's an ICU now. So we've doubled or tripled the size in there. We're sort of drafting in doctors from all over the place and nurses to help with the less sick ICU patients. So there's two types of ICU patients with COVID. One is the ones on a ventilator. Those are the most complex. So the ICU team will take care of those. And then there's another group that's on high flow oxygen, which is where you get like a tube put up your nose and you get like something like 40, 50 liters a minute, like a crazy amount of oxygen. And generally COVID patients can be on that for even a few weeks. And the new team of doctors are going to be working on that. So we're going to be expanding capacity. We're going to hit real limits, and we're going to see if the system holds up. And this is kind of like a game of chicken that our leaders have been playing with. Like, they didn't believe the projections from the epidemiologists. They thought, let's try to turn the corner right when we're heading to the cliff. Now we're in the skidding part where we're trying to skid it into a turn. Let's see if we go over or not. We don't know. Maybe all these measures they're doing now will slow it down. A quarter of the population, the adult population, is vaccinated. That's going to help a lot, and that's going up every day. So a lot of unknowns, dreading kind of what's going to happen in a couple of weeks. Optimistic maybe that maybe they did enough to slow it down, but there's still a lot more they can do.
And what would you say from January until now were some of the things that weren't done to sort of avoid us, especially in Ontario, being in a third wave?
Well, I think schools is the big one. Like for some reason, our decision makers got it into their heads that kids don't transmit viruses like this. Like they transmit everything else. Like if anyone has a kid in school or daycare, you get sick every month with whatever virus of the week they have. Like it was just wishful thinking to think that. We should have made the schools a lot safer. We should have made the teachers a priority. We should have done rapid tests. Like we're doing rapid tests here on long-term care homes. We could have done it for teachers as well, and students. And you don't have to do that, the brain biopsy type of swab with kids. You can just do a cheek swab and a front nose swab to get the COVID results. We could have done all that, but trying to get through to decision makers to do common sense things seems impossible these days. The other thing is like, there's flights every day coming from hotspots. Like I think Vancouver had, from Brazil, they got like the new Brazilian variant. We're having, 2 flights a day coming from India where, things are out of control. Like we could have, like our quarantine system is a bit of a joke. Like it's voluntary. You can just leave and pay a fine. Like how does that even work? That just shows that, I feel like we're not a serious country when we can't even pull together what even a travel quarantine properly. So that's another thing. The final thing, like they could have been done in January, was to make workplaces safer. There's I want to hold out companies like Sobeys that in their warehouses take extremely good care of their workers. N95 masks, sterilized suits, headsets so that workers talk to each other without getting close. Entire procedures dedicated to keeping workers safe, and they haven't had an outbreak. Then you take a company like Amazon, which had 900 out of 5,000 workers sick in one facility. Other companies too that just do the bare minimum. Like more could have been done for that. So there's a lot that could have been done, and sadly, we're in this situation now.
Yeah, it seems like it's a combination of a lot of factors, right? So we feel like at the government level, maybe the lockdown may could have been extended in February, or we could have continued with some measures. Schools, like you talked about, companies could have done a little bit more. Well, could have done a lot more. I know a friend of mine who drives the bus on the same route as where the Amazon facility is in Brampton, and he said drivers refuse to drive that route. They're like, we're not going there, and for good reason. You understand, right? And on the other hand, one thing I'm starting to feel is that even as society, I think over the number of years we've talked so much about individualism, that you don't owe anyone anything and it's me for myself. And it's starting to play out a little bit that you're living in a society, you're living in as part of a civilization, you have a responsibility towards other fellow human beings as others have responsibility towards you as well. And I think that's something that you're starting to see stressed out as well, this whole in this scenario.
Oh,
But
exactly.
I want to ask you about the third wave a little bit. We've heard a lot about the variants, right? And they're starting to become dominant. So, what is it about these variants, or what is it different about this third wave that by all accounts, we're
Mhm.
starting to see more younger people end up in the hospitals right now?
So what's happened is that you've had mutations to the virus on certain parts, like on the surface proteins, that seem to make it more contagious, and it seems to affect younger people. I started seeing this about 3 weeks ago. I put a picture on Twitter, which just went viral because it was the first for the world seeing it, that young people were just getting pummeled by this, like with this one person I saw, she looked like pure death when she came in. She could barely stay awake. Her oxygen levels were in the 50%, which is extremely low. Like it should be 95% plus. And so it seems to do that. And that was the UK variant. We're looking at Brazil with the P1 variant and another mutation in another area of the virus that seems to really afflict young people. So I think that's the thing that's changed. When we looked at the number of school outbreaks, and a group I'm with tracks these called Masks for Canada, we noticed that school outbreaks increased at twice the rate as the second wave, which led to the closing in December last year. So we reached the point a lot faster, and we knew we would too, because the UK went through exactly the same situation in December with their variant, but we just chose not to do anything. So that's probably the primary reason why it came faster. Our leaders didn't react fast enough, but it could have been prevented because it was all foreseen before.
So maybe just to build upon that, so we knew, or we've seen these sort of mutations that have created all of these new variants. And I guess one of the things I've seen in the UK is that, similar to us, they've been challenged with these variants, but they've been able to roll out their vaccination in a way where it's being done very fast within their population. Like what has been the challenge here for us? Because just me as a citizen watching from the sidelines, there seems to be an issue with us vaccinating a large amount of people, and a lot of misinformation as to why that is. Like, why are we not vaccinating at a rate to get to a point where we have a large percentage of Ontarians, or let's say Canadians, vaccinated quickly?
So we are now, as of like this week, at the rate where we should be. Like in Ontario, I think we're hitting about 100,000 people a day, which is a great thing, but it took a long time to reach here, and there's a lot of bugs on the way. The booking systems aren't that great. I helped a patient book yesterday because they They had trouble with computers. I had to go through maybe 5 or 6 different screens, confusing layouts and everything. There's a lot of work that could have been done, and we had a year to prepare for that. But it is happening. Thankfully, the government here has changed tactic and is actually going to areas like apartment buildings and factories in affected areas. But I think the UK was just better prepared. They had a small group of people that organized their whole effort quickly without much government interference, and they were allowed to do whatever it took. They purchased everything ahead of us too, as the Israelis did, as the Americans did. They had access to stocks that we didn't. So that's why they were able to vaccinate faster. And they've got far more of their population covered than we do. I think more than 50% now.
Yeah.
We're at best with one dose, a quarter of the population, the adult population now.
We're about 19%, I think.
19%, so a fifth, almost a fifth. It's going to grow fast. Like I think we'll have half the population by the end of the month, hopefully, or in about 3 to 4 weeks, hopefully. But we have a lot of catching to do. Like the switching to the one dose strategy is turning out to be like, it was a good idea, I think, at the time. And I'm glad that governments followed through and did it. That's something that we advocated for. And it looks like, we're collecting information from in physician forums across the country that even if you do get sick and you've had 2 weeks since your first vaccination, you're going to get a mild illness at worst. I haven't heard of anyone getting critically ill post-vaccination, even with one dose. Some people are sick right at the time they get the vaccination or maybe a week after. Those are unfortunate, but they'll happen. But if you're 2 weeks after a single dose, you're fairly well protected, it looks like. So I think, there's a lot of things we could have done better. We could have purchased earlier. We could have planned the rollout better because it took, 3-4 months to get our system kinks worked out. But now that we're rolling, I think things are going to go fast and they're going to go well, hopefully.
Right. And so is it really an issue of, because this is where I sort of get tripped up when I read everything. Is it logistics at a sort of provincial municipal level, or is it also supply from a federal government level? Because there seems to be a politicization of all of it, and there's a lot of fingers being pointed that we don't have supply, but I'm hearing we do have supply, or the provincial and municipal areas, they're just not logistically equipped to deliver our vaccination.
Kind of both, I think, right? Like supply-wise, the federal government is basically reliant mostly on Pfizer. Moderna shipments are kind of go up and down if you look at the tables that they publish. And then AstraZeneca is a big question mark because the way things are going in India, are they going to keep shipping things to us, I guess, is the question. Like India is like, their curve is like a straight line up now. So I don't know if they're going to send us anymore the way things are going. So that's the issue there. There is domestic companies that are working on it. Like there's 3 companies in Canada that should have something available by September, but that's a bit late for us. But that's something that should have been explored earlier. Like we have the technologic expertise to make mRNA vaccines here. And we should have pursued it before, but at least it's being done now. On the local level, Ontario did something funny in which they let every region do its own strategy. That's paid off in certain ways where you have a region like York region, north of Toronto, which is really the farthest ahead in vaccinating people. They don't allow any spot to be unused, and they'll just keep moving down the ages if they have unused spots. So they're vaccinating people in their 40s, like early 40s now. And they'll try to catch up to the people who didn't book as well. So whereas you have other regions that are further behind. So it's a great example to see, how well do bureaucracies perform. Like I think people should be taking notes, like what features allow one region to do better than the other, because we never really get to compare civil servants and judge them. Maybe this is an opportunity to do that. So the provincial government here also didn't have a big portal ready in time for the whole province. So each region had to make its own system cobbled together with, Office 365 or Salesforce or other enterprise systems. So, and they're hard to figure out. They're not intuitive. There's a lot of issues, but honestly, like I'm sounding like a broken record, but you had a year to figure this out, right?
It's kind of interesting that you're testing the system and rolling it out on March 5th. You should have been ready on November 15th, in my opinion, right? Like,
yeah, exactly.
And that's interesting. You mentioned that, this decentralization has sort of paid off. York is one. And even if before the Ontario government announced 18 plus for hotspots, we knew that, in East York, they had started doing that somewhat similar, right? I had heard of a situation where they went door to door and vaccinated the entire apartment building just because the positivity rate in Thorncliffe, for example, was really high at that point. Well, it still is, but so yeah, that's interesting. But the other thing I would just want to ask about the ethical framework that was created to roll out vaccine, right? And you can see why it was done in a certain way. Okay, they had a lot of consideration, and in all honesty, it's not an easy decision to decide how to prioritize one way or the other. Someone will always, criticize you for it. But what I what I fail to understand at times is, why is it something like the teachers were not, prioritized, or even, let's say, frontline workers? Like, I mean, I'd like to get vaccinated, but I mean, I'm still working from home. But if I go to Walmart, someone working there on a daily basis, or at Superstore, um, how do we prioritize these individuals, or why didn't we do that in the first place?
So I think what's good is that they've been responsive to criticism like this,
Mm-hmm.
right?
Mm-hmm.
First of all, like what changed was, and this was only 3-4 weeks ago, it was just really getting young people. Before that, the assumption was they only got mild illness most of the time. But when things started to change on the ground, that's when priorities shifted for the ethical frameworks. And I'm glad they did when they started doing essential workers and frontline workers. So I think that's a good story. Like, I think new data led to a change in the way things were done. But the ethical framework on like other issues, like how to allocate, there's always going to be a lot of debate, especially when there's such a restricted resource. I don't think there would have been a correct answer that would have made everyone happy.
100%. Yeah.
Like they prioritized at the start. I only got my dose, and our ER group got our dose when a lot of long-term care nurses didn't want it. Like half of the nurses that were invited didn't show up, and so we just basically said we're gonna get those doses. I don't care what you say, and we took it. But why did we get such a low priority when we're like being coughed on every day? So that like there's a little bit of virtue signaling, right? Like in some of these decisions, like, and sometimes you just have to make decisions that will benefit more people who are more exposed at times, like prioritizing the frontline workers, like in Walmart or in grocery stores versus people who can work from home. That would have been one thing as well to consider, but I think that's happening now, so that's good.
Mm-hmm. No, and as we mentioned, like, it's hard, right? One way or the other, you're always going to get criticized. It's a very, like, it's a very tough situation to be in.
Yeah,
because it's a situation that's very personal to people, right? Because people think, well, I have pre-existing conditions, I'm an essential worker. It's really hard. It's really hard to decide what that criteria is. And I think that's where we get into the judgment of like who got vaccinated versus somebody else.
well, I'll tell you one thing we could have done. Like, so my father-in-law, like my wife is from Nova Scotia, was that they're not afraid like we are. They're living completely different lives than us, and he's getting his vaccine in 3 weeks, and he doesn't mind because he's in his early 80s, because he's not going to catch it, because there's no community transmission of COVID there. Like, we could have basically made this whole debate and discussion moot by actually getting this thing under control. We had a golden opportunity last summer. We had a small opportunity in February if we kept things going and we, did all the measures that we talked about. And we're going to do this again. We're just going to paper over stuff in the summer. Cases are going to come down again. We'll have a golden opportunity again to get rid of community transmission, but we're not going to take it. And then we're going to have another wave in the fall when you have kids going back to school who are unvaccinated. They're going to spread it to adults who aren't vaccinated, and then we're going to start filling the ICUs again. About 30% of the population won't want the vaccine. They're all vulnerable in the fall, and we'll be back in this boat again. Instead, we could actually commit to difficult things in society, like let's get rid of community transmission of this thing. Let's get control of the borders, stop all these flights coming from the hotspots, and test everyone on arrival and 3 days after, that kind of thing, and really, really be determined about this. But I'm not optimistic, honestly. I hope they do it.
Yeah. I also, maybe just to pivot a little, I remember reading about Israel seems to be a really good example of how they've gone in, small population, maybe comparable to us, vaccinated a large percentage of it. But the reason was is because their data was very good. They were able to track everybody, know where everybody is. Are there any sort of learnings from a Canadian perspective in terms of data? Like, do we think our system doesn't have those sort of data capabilities to have done that kind of sort of tracing and managing and being able to vaccinate people at the rate that in Israel did?
So Israel is really unique in which they have 4 major health providers. Imagine having 4 ministries of health working in parallel,
Oh, wow.
competing with each other, and you're required to be part of one of them. And so they all have great infotech systems, and they were able to share that kind of data with the vaccine makers. Ours is scattered throughout different regional authorities. So like one region's contact tracing system doesn't talk to another region, so it's very fragmented, like in 31 different areas. I think Ontario is trying to fix that with Ontario Health and Ontario Health teams. So that's slowly getting better. I hope hopefully, God forbid, another crisis doesn't come, we'll have a more integrated response, and we can provide an attractive platform for a vaccine maker to give it to us first next time.
And the other thing I was reading was very interesting because it was a comparison between Israel and EU, because, I mean, you have a lot of facilities manufacturing these mRNA vaccines within the EU, and EU has sort of botched the rollout. I think they're right around us. Germany is actually lower than Canada, which is pretty interesting. And
As am I. Actually think the EU is lower than us in terms of
yeah,
vaccination
could be,
percentage. Yeah.
could be.
Or last I checked, I'd have to check today, but I think they were tracking lower than Canada.
And one of the reasons I think what happened was that they were still haggling over the price with the manufacturers, whereas Israel not only decided to pay more, but they also decided to take over product liability. And they didn't even, had any issues around that. And it's interesting, in a crisis, you try and fix it, and then it shows the success. In fact, it seems like that Britain probably did better by moving away from procurement. They were going to do it with the EU first, and they decided they'll go their own route, and they've managed to vaccinate a lot faster. But with Ontario Health that you mentioned, like, are we going to eventually see in sometime in the future that integration of system is one, but even having something like digital vaccine passports, like we have NFC technologies and phones and things like that. Like, do we still need to carry those orange booklets that says you've been vaccinated on this day? Like, do we have these kind of learnings that, okay, we're going to get through this eventually, one way or the other, but on the other side, are we going to look better coming out of it?
Well, yeah, like the EU is definitely not looking better. Like it's like we think our provincial federal problems are bad, but like the haggling, it was almost like a Soviet bureaucracy that runs the EU. Like no one wanted to take responsibility.
Sorry, that's funny.
They passed the buck, like, and basically bureaucrats who are used to the safe way of doing everything just sat on it until it was too late. Basically, now they're paying the price. So I think the Americans with Project Warp Speed took the attitude that we'll pay whatever it takes to get out of this. That's the one thing Donald Trump did right was just gave them $15 billion and a blank check and just go do whatever you need, and that's what they did. Will we be able to do that? I think a lot of it falls on these capabilities of the civil service. We need to reward people in leadership positions who can take the initiative. There's evidence of that already with some of the stuff that we saw. Like we saw how quickly the CERB was implemented. Like, millions of Canadians got support immediately, like the next week. It took a long time for the Americans to get their version up. So there's versions of that. Like there needs to be, because challenges are only going to increase, right? Like especially from climate change and unexpected things, migration, other challenges in the world. We need civil service and leaders who will be able to push back on politicians and grab the initiative and take charge. Whether Ontario Health will be able to do that in the future, I don't know. I think we'll have to see how they handle this surge. If they perform really well, we'll see, I guess.
So let's talk a little bit about the vaccines. So the backbone of Canada's rollout has been Pfizer and Moderna, majority of the people getting those. AstraZeneca has been in the news a lot because of a potential link to blood clots. EU pulled the trigger a few weeks ago, and then they felt that there may be a link, there wasn't. Then they stopped vaccinating with AstraZeneca, but then they went back to it. Recently, we've heard Johnson and Johnson. There was a death link to it in the US. What are your thoughts on that?
So it seems that there's two types of vaccines that are working for COVID. So one is the Pfizer Moderna. These are nearly identical. They're pieces of mRNA, which is a code that your cells use to make a protein, and then your body reacts against that protein and builds an immunity. The other one is the Johnson and Johnson, the AstraZeneca, the Russian Sputnik vaccines. These are all what are called viral vector vaccines. So they take a virus, a cold virus that infects chimpanzees. So I don't remember which one, adenovirus 5 and adenovirus 26. And what they do is they splice the genes and they put a SARS-CoV-2 protein inside these viruses. You get infected mildly with this virus. Your cells meet the SARS protein and form an immunity to it. So you're being infected with this chimpanzee cold virus. It looks like for this whole class of vaccines, in very few rare cases, it produces a response where your blood starts attacking its own clotting factors and you form blood clots, dangerous ones. And so there's been, and it seems to affect young women the most. And there's been reports of deaths in Europe from this. The concern is, it's killing very few people, but it's affecting the group of people who probably wouldn't have died from COVID. But if you do the numbers for a whole population level, it's still more beneficial to protect from COVID than to risk it. It's one of those situations where what's good for the population may not be good for individuals sometimes. But when you have more choices, it might be worthwhile to prioritize Pfizer and Moderna. If I was a young woman right now, I would definitely prefer those vaccines. And I think in Health Canada's decision to limit it to people above 55 is probably the right way to go right now. But it could probably extend to younger men. But for women, if you have other options, and I think they should be prioritized, should probably get the mRNA vaccines.
So I've got an interesting stat in front of me. It says the rate of blood clots from COVID is close to 15%, but we're stopping vaccinations over like a 0.001% chance of blood clots. Like what?
Yeah, it is. Yeah, COVID is pretty awful. Like it'll cause people to have strokes, blood clots in their lungs, blood clots in their legs and arms. Um, yeah, it's a tough decision. I think perhaps people can be offered it if they know what the risks are, like if they understand it. But I think for young women, it was 1 in 25,000 or 1 in 250,000. I can't remember the number. So it's a lot higher than we expected from this. But again, for the whole overall population, it's generally safe. But a few unfortunate people will get the worst side effects, unfortunately.
So then what would you say to people, because I'm noticing it within my circles, people that are hesitant to get vaccinated at all? Like, what would your message as a doctor be to those people?
Oh, I think, you're going to get this either way. Like either you're going to get the virus or the vaccine. You're not going to have a choice. Like this thing is so contagious. Like if we let it rip, like if everyone stopped wearing masks, like probably is going to be expected later in the year. If we open up everything, open up the schools, this thing is going to rip and infect everybody. It's either you choose that and all the stuff that comes with it, including the 15% chance of blood clots, or choose a vaccine which has, extremely, extremely low risks of complication. You're not going to be able to escape it, unfortunately.
So basically get your vaccine.
Yeah, exactly. Like it's the best way. It's the best way also to protect your family, kids who don't have a vaccine yet, as if almost every adult has it, we won't spread it to our kids.
And because our rate of infection is still more than 1, even if you feel that there's a risk of, like, you potentially, if you get COVID, you're still infecting more people than just yourself, right?
Yeah, exactly. Like you get a vaccine, even you might get a mild cold from COVID, but you'll spread it to everyone around you who doesn't have the vaccine. So you still have to be very careful until we reach herd immunity or everyone in your household is vaccinated. Otherwise,
Yeah.
you're a threat to them.
And
So
just
if
to
there is a concern, how does that impact the rollout that everyone, if supply continues, they're saying everyone can get one shot by Canada Day. How does this limiting factor with AstraZeneca and Johnson & Johnson impact? Because now you're stressing more on Pfizer and Moderna, right? And as you mentioned, Moderna has been a little bit patchy in terms of deliveries. So now you're just basing it on one vaccine, right?
So I think a few things. We're fortunate in Canada that I think 90% of our strategy was based around Pfizer and Moderna anyway. So we'll have more than enough. The other thing is the Americans are going to run into more supply than demand probably in about a month. They have a lot more vaccine hesitancy than we do. I think about 40% of the population doesn't want it. So at least the Republican half, I think. So they're gonna, and a small amount for them is gigantic for us. So it wouldn't be hard to just get their extra doses. So I think we'll have more than enough to give at least everyone a single dose of vaccine by July 1st for sure. And then we can start giving everyone the second doses after. And we can also make the second doses. There's a good study that's promising in the UK that you get your first dose is AstraZeneca, you can get your second dose as one of the mRNAs. So probably you'll be able to get the second dose with
really.
Yeah.
Would you happen to have a link that we can share?
I'll send it to you.
Please. Okay, that would be great.
That's interesting.
That's interesting because you're looking at viral vector as the first one and then mRNA as the next one, and it's still working. Okay.
Either way, you're getting that one protein from the SARS-CoV-2 virus, the spike protein on the surface. They're both giving you the same thing so you build an immune response. So it really shouldn't matter how you get it. And if you can get it the way you can get it with the mRNA without the side effects, then that's the way to go. Get your second dose of an mRNA.
So from just a layman perspective, so what one is doing is so the mRNA vaccine helps your body develop the spike protein. The other one's just injecting the spike protein.
It gives you the second one, the AstraZeneca, is a virus that helps, that has the spike protein in it. And your body reacts to that.
Okay. That's very helpful.
There's also been a lot of information around COVID is here to stay. It's probably something we'll need to be vaccinated on an annual basis. Do you see then the vaccine evolving? Like, the vaccine that we have today that we're using, will that have to be looked at sort of at an annual basis, sort of like the flu shot and other vaccinations that we have?
Oh yeah, I think so. Like unfortunately, it looks like the current crop of vaccines seem to work for all the variants so far. So we haven't seen any people getting seriously ill with the vaccines who had it already with COVID. So it's possible, like if what's happening, the rest of the world is not getting vaccinated. It looks like there's going to be a big setback with Johnson & Johnson and AstraZeneca. They're going to keep generating new variants, like countries like India, Brazil, Russia with huge outbreaks. They're going to keep generating new variants. It's going to come through us through air travel. And we don't want to be caught flat-footed again when a new variant shows up that's vaccine resistance, which is why I'm very adamant in public messaging. We need to really control arrivals of people and test them from everywhere. Because the next year or two, until the whole world gets a vaccine, we're going to keep getting variants coming in, and then we get a bad one. Let's say it starts and gets established here. We're back to zero because the vaccines won't work. So I think, we'll probably need boosters. We're going to have hopefully more domestic companies making vaccines that we can rely on for boosters. There's 3 companies in Canada that are working on that, hopefully. But in the meantime, like the government really needs to get a handle on testing travelers. Like they shouldn't allow people to bypass quarantine by paying a fine. Like that's just insanity, honestly. We need to be able to catch variants that are vaccine resistant before they get established in Canada.
And would you say, because you've mentioned this a few times, because I guess part of the economic decision is that you can't really shut down travel, right? I mean, you can. I think countries like Australia have done it. But if we're choosing not to do that, is it sort of like our strategy now where if you know that there are flights coming from hotspot countries, maybe they're managed or tracked differently than if they're coming from other places where maybe COVID's under control? Like, could you see that? Because I don't know if they're doing that. I think it's basically planes come in, planes come out. And I'm not sure if we're saying, to your point, hey, India has a major outbreak, Brazil, maybe we limit flights from there, but not from other places.
But then you have all these connecting flights as well, right? So
yeah,
exactly. So what is essential about travel, I guess?
Yeah, sure. Yeah.
Like, do we want to go through this year again? Like, what is that trip really worth it that can't be, a 3-day return quarantine can't solve, right? If you really have to travel, if you really have to see relatives abroad, especially in one of the countries where it's out of control, then 3-day quarantine at a facility, and then get tested twice on arrival. I think that's the price we can pay. Like Atlantic Canada, they quarantine every traveler from even the rest of Canada on arrival. At home, they do it at home, and it's monitored very carefully, very stringently, and they pull it off, and they're living life normally. That's what we're going to have to do. There's nothing essential about any leisure travel. There's nothing essential about business travel. There's nothing essential about any travel right now, as far as I'm concerned. I just don't want to go through this year again. I want to, if a new variant shows up that is terrible, we need a few months to build a vaccine for it. We need to, slow that down until we can do that, basically.
So as we move towards the end of the episode, I want to talk a little bit about your personal journey and your fellow colleagues in the healthcare system, so doctors, nurses, and everyone else involved. I mean, needless to say, this must be mentally very, very exhausting for everyone, right? How are healthcare providers coping with this? And before we started recording, we talked a little bit about a lot of them potentially could switch fields. Could this have an impact on our supply of doctors or nurses down the road, or people making decisions not to go in certain fields?
I think so. Like people will, what I've seen is I think people will try to get away from frontline care. This happened a lot during SARS as well. A lot of people left acute care medicine after that. So I think I'm already seeing it, like people are being pushed to their limits right now. And the next few weeks are going to really push them hard. So I hope it doesn't happen. But what I've seen is also a lot of really people have stepped forward, where people were content to just take orders and do nothing and just do a job. But I think people are really passionate now. People want to make sure they see a system that's more resilient and something that can handle shocks like this. So I think you'll have both. I hope more people will be inspired to change the system and really make our reactions better. And we'll have to hopefully, I think SARS was a huge trauma. If anyone was in Toronto at that time, I was a medical student. It took a long time. There's a lot of PTSD type feelings from people then. But now, our trauma from that time is everyone's trauma. And everyone's going to need time to really discuss and decompress, I think, once this is over. That burden that you have, everyone shares right now, that can I go out? What am I wearing? Where are my masks? Did I just expose my family to this? That's not a healthcare thing only. That's everyone thing right now. I think there's going to need to be an acknowledgement of that and some kind of healing process, just to see how do we reintegrate ourselves into normal life? How do I, right now on the sidewalk, I'm walking with my kids, I jump onto the road when I see someone. That's not normal behavior. That wasn't normal until this year, right? How do we get past that? That's a conversation that needs to happen.
Yeah, and
there's only so many elbow hellos, right, in you. So
yeah, my hope is if we come out somehow as a better society, right? Understanding that there's a collective responsibility towards each other. It's important, right? So maybe we need to look at a lot of other things, because I mean, generally and this is something I'm starting to feel a lot more recently. We've always pushed individualism and just being yourself so much that maybe certain countries that are doing better than us, there is a sense of collective responsibility, right? Especially the East Asian countries that you see. And I think just me, myself, and I doesn't always work, right? And other people have the same responsibility towards you in some shape or form. So hopefully we do whenever all this ends, we do see some better society, like, from a societal standpoint and economically better. Fassi, do you have any?
And Kashif, I would say sort of what would be your last words or advice to our listeners, especially in Ontario? Like, what are the things that we should be thinking, we should be doing to basically get through this over the next few weeks?
Yeah, good question. So the next few weeks are going to be the toughest few weeks of this whole pandemic. Don't get sick is my advice. Is don't go indoors anywhere right now. This virus, new variants could be airborne. That means it floats in the air for a while. You could get infected just casual contact. Even if you're going outside and you're talking to anybody, wear a mask to do that as well. Get your vaccine as quickly as possible. Be proactive. Don't assume that someone will call you. This is something where you have to really, the system is all over the place. Things are different in every region. You have to be proactive and find out. You can't just assume someone will look after you. Longer term in this, we're going to have a chance to beat this. Things are going to get much better in July with schools out, with the vaccines and everything. Really look at getting rid of this completely. It's called zero COVID is the idea. And I think it's the only way to really make sure that schools are safe in the fall, because kids aren't going to have a vaccine ready by then. Otherwise, we're going to face another wave of this, and we're going to have this thing will keep on going. So I think with simple things like rapid testing of students and workplaces, really good controls on travelers, making workplace safer, we can make it a lot safer for kids. Otherwise, we're going to be, back in the same cycle again, and we really don't want to be, right? We're sick of this. I want to go back to working in the hospital, not being on TV talking about this stuff, right? my messy office on TV all the time.
You do a great job, though. You do a great job.
No, we really appreciate it.
And you do a great job on Twitter. So I think it's at Cash Prime if anybody wants to follow you on Twitter. I know I get a lot of my medical updates, so I appreciate. Thank you so much for that.
Yeah, you and a few doctors, you've done a great job in keeping everyone updated, and with your messaging around advice, staying indoors. So we really appreciate that. But on a lighter note at the end, we asked you this question last time as well. Anything else that you're reading right now, if you have any time, that is?
I had just started a new book, actually. It's called The Mission Economy, by, one second, let me get the name, by Mariana Mazzucato. Mariana
Mazzucato.
Yeah, so she has the idea, like I was mentioning before, like high functioning, our governments need to be higher functioning and really be proactive and anticipate problems rather than just passing the buck. This applies to academia too. Like one of the things one of our group did was we helped organize we got out one of the WHO advisors on why we're not wearing N95 masks. And we found that the academics and the advisors for a lot of these bodies are really stuck in, ass covering and being defensive and building academic careers based on like worthless papers over many decades. These are our decision makers, right? These are the people who write our guidelines, and they're not able to respond in a crisis or be flexible. And so what she's calling for in her book is like develop the moonshot type thinking, is that, we were ambitious once. We were able to do impossible things once as society, and we can do it again, and we'll have to do it again the way things are going. And we need to, and I think the pandemic's been good in bringing up a whole generation of leaders who are better at this than the old systems. Like maybe we need to look at academia and not reward people who are in safe careers and doing the safe studies every year. We need to reward people in the civil service who are initiative takers. And same thing in politicians. Reward the politicians who've really, really done well in all this. Like, the leadership in Atlantic Canada. There's a few public health officers in Ontario who've always been ahead of the grade, like in Guelph, in Ottawa, and Kingston. Reward that behavior.
York region too, no? York region or?
York region is a bit of mixed bag.
Yeah. And I think the important thing is when I 100% agree. And when you reward these people, don't just reward it on outcome. Like, I mean, if someone's taking initiative, people will sometimes make mistakes, right? And then that's something you have to learn to accept and appreciate as well, because if failure always gets penalized, then that initiative goes away. But Marina Matsukazu, great economist, actually is someone we're trying to get a hold of for our
Yes.
episodes. If
Oh
you're
my God.
listening,
So
please, we'd love to have you on.
hey, if she's listening, come join us for a
Please,
conversation.
I read her book,
100%.
Value of Everything, last year or a couple of years ago. Fantastic writer, so very thought-provoking ideas. So I would definitely read Mission Economy. Lastly, a serious question, it just occurred to me. The role of multilateral institutions, they haven't really done themselves a lot of favors during this time.
No, especially WHO. We found it to be really ossified decision making through opaque boards that don't really react properly. They were late to recognize asymptomatic transmission. They are late to recognize airborne transmission, which is the main concern right now. And I think we need to rethink our relationship with them. We need to chart our own course. I think maybe the Western world needs to, because their director general, I think, was almost like an apologist for the Chinese. And there's more and more evidence that they're hiding information on how this started. So I think maybe the Western world needs to go its own way on this stuff.
Hey, Donald Trump wasn't wrong about everything.
No. Well, you see Biden is pursuing a lot of his China policy. So
Yeah, he hasn't removed any of the tariffs.
No.
yeah, for good reason,
Yeah.
I think.
Mm-hmm.
Yeah.
But no, we thank you very much for your time, Dr. Kashif. I really appreciate you coming on again and answering a lot of our questions.
No,
Yeah,
thank
and
you, and stay safe. You've got a few weeks to get through this.
yeah, and best of luck to you and the family. And maybe when all of this is done, we could do a final wrap up, the three of us, and see where you're at and maybe where we're at
Maybe
come the
the
fall, right?
maybe we can title that episode "COVID Zero COVID," right? Hopefully.
Zero COVID,
I
yes.
would love for it to be zero COVID.
Oh yeah,
Amazing.
God willing, we'll get there.
Yeah,
Hopefully.
exactly. Okay. Thank you very much.
Thank you, Dr.
Yeah, have a
Kashif.
good day. Bye, guys.
Have a good
Bye-bye.
day. Bye. We hope you enjoyed our episode. Your feedback is always appreciated. You can email us at futureof19@gmail.com. You can also visit our website at www.ftrof.com, as well as follow us on Twitter, Instagram, and Facebook at futureof19. You can subscribe to our YouTube channel, The Future Of. Please leave us your comments about what you liked, what you didn't, and what would you like to focus on for future episodes. We'd love to hear from you. And lastly, if you are enjoying our episodes, if you enjoyed season 1, looking forward to season 2, please consider supporting us at Patreon at www.patreon.com/futureof19. Thank you very much for your support and have yourself a wonderful day.